Good afternoon, everybody. This is Reality Bites with Dr. B. This is actually our first episode, and I've invited Dr. Bob here. We're getting off to a little bit of a rocky start, and because we were hoping that this is sort of an organic thing and it takes the direction it does take, we didn't have anything prepared. But we're off to a rocky start because we had a bad day. We just started off our YouTube channel, and we just realized we got kicked off, and we don't know why. So that's kind of put me in a bad mood, but hopefully Dr. Bob comes up with some stuff that we can discuss today, and I'll let him actually do some introductions here.
Okay, good. Thanks for having me, Dr. B. I'm happy to be here. My background's in clinical psychology. Dr. B is a physician, and most of my work in addiction recovery for the last 40 years has been looking at addiction from a psychological perspective, and I'm still I'm completely involved in that right now. That's all that I do. And Dr. B, your background is in emergency medicine and addiction from a biomedical perspective. I would assume that that's primary for you. But one of the things that interests me most about being here with you, which is a rare treat for me, is that Dr. B is extremely literate in looking at the social, the cultural, the political, the economic context for addiction. I'm very interested in that topic, and I don't get nearly enough chance to kind of talk into that with a kindred spirit, and I feel that deeply with you. And so I'm here to go where we go, but I care a lot about that. So if I can make a vote, it would be that we talk into some of that context as well. It's highly relevant and rarely discussed.
Great. I couldn't agree more, and you are right. I am very interested in that. Mm-hmm. And just as a platform for us to take off, given my hesitation that we just got kicked off of YouTube, and I'm not sure why. That being said, my interest is as such. Obviously, I look at addiction as a disease, and I like the disease model. Not because that has any truth status, but the truth status for me is as such. I can use that model, and I can predict whether it's I use medication to treat or the outcomes. And so that is of high utility when you're trying to, whether it's you're trying to prevent further illness or you're trying to prevent death. That being said, I'm well versed and immersed in that, and I use it every day. But as time went on, and as I have, I enjoy different things. I'm not a sociologist. I'm not a psychologist like yourself. I am not a social theorist. I don't know about public policy. I do know quite a bit about public health. But as time went on, and as I was sort of looking at the world around me, as I like to think I have my whole life, and impose some sort of formal study of that world to understand it, I started to see that addiction really fits in the context of a sociological, psychosocial, and sociological really description. And to that extent, one can predict outcomes and make a commentary or criticism of what addiction is in that context. So, to put it more concretely, I find it a manifestation of our greater social pathologies, if that makes sense.
Yes, complete sense. For example, I agree completely with your premise. What's one example of a pathology that's a global pathology that manifests personally in terms of a disease process like addiction? What would be one example?
So actually that's a great question if I understand it correctly. So for example, even if we went to what we really consider disease, looking at it from a social perspective explains a lot. Okay, diabetes. Okay, so we can say this. If I take a group of people, let's say a certain group of people that live in a certain part of Alaska that are native to that area for 1,000 years, and they've lived well there and prospered for hundreds and hundreds of years. Now there is a mass exodus and immigration for whatever reason to mainland USA. And you will see that generation after generation, diabetes starts popping up. So that being said, even diseases that we so deeply think of, sort of way someone approaches it, a layperson approaches is that is a disease that has to do with the body. And then we start discussing things like diet and exercise. Well, now you're outside the environment, and diet and exercise is part of your socio-cultural background. But even more than that, we see things like immigration causing disease. I'm going to give another example that's even further up your alley, and it really makes a more profound point. schizophrenia, and if I recall correctly, it's a study many years ago, and somebody looked at the rate of incidence, the number of the new cases of schizophrenia of, I believe it was Ethiopian, but I'm not sure, African country that moved to the UK. And in the first generation immigrants, the rate of schizophrenia was something like 2, 3, 4 times higher than the international average.
Wow.
That is very profound.
Yeah.
And then, you know, it makes one ask the question, well, what were the environmental
Yes.
factors and
Yeah.
stressors
Yeah.
that have severely affected the incidence of this disease?
Yeah.
Again, I don't remember the details, which country it was. I know it was into the UK. But when you look at that, then you'll go into something like addiction, which
Yeah.
we're trying to look at it as a disease model, but it's a very complex disease.
Yeah.
And it's obvious it has a lot to do with who you are within your sociological context.
Yes.
And that being the case, it's only natural to make that implication that we can look at it in that way,
Yeah.
make some
Yeah.
predictions, and hopefully by addressing this and public policy and public health issues, we can do something in the overall treatment of
Yeah.
it. Does that make sense?
I like what you're saying a lot. My training in psychology, one of the criticisms that could be made, and rightly so, is it's hyper-individualistic. You know, if you think about U.S. culture, there was a Chinese anthropologist that came to the U.S. some years ago and was tasked with studying American cultural patterns, and he was asked at the end of his study to define, if he could define U.S. culture in a single phrase, single word, what would it be? And he said, you're the most self-reliant culture on the planet. And you could translate that into being individualistic. We're the most individualistic culture on the planet. So Bob Weathers studies psychology here in the US. Well, big surprise, the psychology that I've been steeped in is very individualistic. So let me give you an example of what runs contrary to that. About 20 years ago, I chaired a doctoral dissertation at a local university. The student, I'll mention him because I'm proud of what he did, and he'd be proud to be named, Michael Wetter, did his dissertation. It was a nationwide study of behavioral patterns in third-generation survivors of the Holocaust. I was thinking of this when you mentioned Ethiopia. Third-generation survivors of the Holocaust. He was one of them. So it wasn't his parents, it was his grandparents that survived the Holocaust in Germany. So 3 generations later, so he did a nationwide study. It was an authoritative study. This is not going to be a surprise in light of what you just cited around Ethiopia, but what he found with third-generation survivors, which were his generation, is 10 times as much evidence of anxiety, depression, organic diseases, and addiction. So let's look at my background in psychology as an individualistic psychologist. I can work with Michael. Well, let's say that Michael's my patient. He's coming in with addiction. If I don't take into account what it is that is probably the single biggest contributing factor, is that whatever happened in Germany that got passed on to his parents from his grandparents, and then to him, if I don't address that, and he did address this in his dissertation, if I don't address that, imagine how hamstrung the treatment would be of Michael's addiction, were he to be addicted. He's not, but if he were to be addicted, you can imagine if I've got this kind of myopia like this, how much data I'll be missing. And my background in psychology would not prepare me for that, more of a sociological or cultural anthropological perspective. Were I not interested in those independent of my psychology background, like you as a physician with books by Emil Durkheim on your bookshelf, were we not steeped in these other perspectives, if we were just kind of standard practicing physicians and psychologists, we might well miss the most important data.
Absolutely. And that kind of can bring us to the everyday treatment of this community that we are doing. Whether it's in the medical office with medication, or things that we usually call residential treatment, IOP, PHP. These are just aftercare group counseling things. And if what I'm saying is true, and the society this treatment is couched in, we're actually not even addressing recovery. Recovery to what? The very thing that caused the situation in the first place?
That's a little bit crazy, isn't it?
Right?
I don't disagree with you. That's a little bit insane.
If society is promoting, if what I call corporatization of the social order, if increasing economic polarization, if hopelessness if lack of human bonding, which Durkheim would agree with, if these are causing to anxiety, depression, existential angst of a whole generation, what am I treating them for? To get them back to that same place where they started? And so that has been a big question for me, and a big barrier in treatment, because that society that didn't give them the resources to not become addicts in the first place, I'm trying to push them back into that. But I have realized that what I'm trying to do is push them back into that, not to participate, but cope and have as productive as a life as possible with the tools they have and society allows them.
I love the critical perspective that you bring to this. As you were talking just now, I was thinking about, 42 years ago, I went back to college as a psychology major, and the first course I took was a personality theories course, and I so appreciate this. The professor for the course, Orenberg, required for us to read this massive textbook on personality theories, and then he had us reading Freud and B.F. Skinner and some of the major theorists and so on. But one of the books that he required for that course was a little book by two sociologists, and they were husband and wife. I don't remember their first names, but I remember their last name. It was Putney and Putney, and the title of the book by Putney and Putney was The Adjusted American, and the subtitle of it was Normal Neuroses in American Society. And their central thesis throughout that book was that if you could summarize all the things that are normalized in our culture, they said their term for it, coming from sociology, was that we're a culture that is wedded to indirect social acceptance. That was their term. And so rather than me being okay as I am, I'll be okay if I drive your car just like you, or wear your designer clothes, or whatever it is. And so they did this lengthy analysis of how that's not questioned. And so what you and I could do, if we're not careful, is we can help socialize people into a society whose values they were questioning. That's the premise of advertising.
Exactly. I was just going to point that out.
So we have to be careful, because just in the context of addiction, what if one of the primary sources of my addiction is that some part of me does not want to go gently into the night of that normal neurosis? What a difference it would make to see somebody like you that at least questions critically the uncritical just consumption of all of that, versus somebody who would say, Bob, you're not adapted to society. Let's fix you. Why don't we just give me a frontal frickin' lobotomy?
I mean, you just opened up so many cans of worms that I want to talk about. I don't even know which one to address, and I'm trying to really stay on topic, but you hit so many things and everything that you said. I don't want to go well, if I can remember, let me address them one at a time.
Sure.
We might not even get to them. One of them was this. I think we talked about the other day. We had some of the kids there. We talked about these are hypersensitive people.
Yeah, we did talk about
right?
that. Yes.
So the addict that I've noticed, these are very sensitive people, and I don't mean themselves sensitive, which they are, but sensitive to reality.
Yeah.
And so they could sort of sniff the bullshit.
Yes.
And as this social order becomes, as we become more technologically advanced, we are creating, these guys don't even know how to make friends anymore, because the idea of friends, you're like, hey, that's my friend. Have you ever met him? No. I've been talking to him for 5 years on this thing. So these things that are sort of disintegrating our sense of self, our sense of integrity, our sense of pride, having a meaningful job, having a meaningful potential future, making whatever it is, making friends, growing up in a complex society that you're participating in, as all these things are gone, right? The question is, maybe the kid doesn't want to go back into that reality, and that's a major challenge. I don't know what to do about it, because I'm not sure what to tell, let's say, Joe. Okay, you're 22 years old, and you've been doing dope since you were 15. You haven't really developed your frontal cortex. You have no schooling, okay? And at the most intimate and physical level, they're feeling the pain, because it's not some abstract existential angst. It's like, What do you want me to do, Doc? Go work at 7-Eleven for the next 30 years and barely survive in a room when I have absolutely no prospect, there's no social safety net, and
I have a thought here. I have a
Go
thought
ahead.
here, and I'll put it out there just for us to chew on. Love what you're talking about. Love what you're talking about. I want to bring in psychology for just a second. I'd be really interested in your response to it. I tell you, I've sat in groups with you. My eyes are tearing up because I feel so strongly about this. I so appreciate the fact that you've created an environment in your treatment setting where clients can have somebody that gets this that you're talking about. And I see them respond to you. It's like, at least you're not feeding them a line of double think or speak or whatever like that. You're feeding them something that you're seeing things clearly. The thought I have from psychology is this. Let's take Joe, just exactly how you described it right there. And it's painful to hear that because you and I both know plenty of examples of Joes like this, is that from a psychological perspective, we talk about what is it that will activate the ambitious sector within an individual. And much of the research suggests is that people will respond most powerfully in terms of developing the part of them that would aspire to something more than 7-Eleven. They'll respond to what we call mirroring, and it's a very specific thing. It's mirroring of their ambitions. And so hang with me just a second, and I want to check this out with you, is by virtue of the fact, Dr. B, that you see Joe and you see his plight, and you don't ignore that you stay with that. In fact, you're pushing him to consider something more than 7-Eleven. By virtue of you doing that, from a psychological perspective, you're providing him probably what our culture doesn't supply, and more than likely what his family of origin didn't supply, whatever that family unit looked like. And so you're doing, from a psychological perspective, probably the one thing that can be done. It may not be enough because there's no magic bullet in this, but the fact that you're shining light on this with that kind of critical perspective, I can think of people, because I sit in groups with you, I can think of people, and you can think of them too, we can think of some of the same individuals even right now. You can see them light up just by virtue of the fact that you've taken a radical perspective on whatever it is that recovery would be. It's not a mindless recovery that you're suggesting. It's not a cultural adaptation recovery at all. And I feel like that we can do. We can light a fire, and we can both live true to it as much as we can ourselves, and we can invite them to do that. You invite them to be non-compliant. And I mean that in terms of the larger social cultural context. And you see them wake up to that. They go, this is, because many of our clients have been in multiple treatment settings. They ain't in Kansas no more. No. not in this group. So anyway, that's a bit just the mirroring piece of it is just like that. We can offer that, and you speak that lingo. I speak it too. I care a lot about this. Yeah.
It's funny you said that. Promoting him to be non-compliant. So subversive. And
subversive is a great word for it.
And so these kids feel that what the road they took is. There's an intuition that, if you go back, let's just take heroin, and if you go back both in terms of literary, but multiple cultural things, that is the subversive to do. That is the saying, F you to the establishment. Yeah. And in reality, what I try to show is that it's actually not. You're actually responding to what the environment wants. But let's be subservient, let's rebel against this by recognizing what's out there. And this is where I go. Hopefully we get to this if we build what we're doing over there enough, is providing opportunities for them to have things, which I guess nowadays they call them progressives and so forth, but I've been saying the same thing for 30 years. That's why I use words like co-op. That's why I use words to them like service to others. That's why I use words to them lend a hand, because I want them to understand community, trust, and build your growth and foundation as a human being on that, not on the Gucci purse, not on the BMW or the Porsche. And hopefully we'll get there. I don't know if we will, but I firmly believe.
You remind me of Carl Jung when he talked about addiction. He in the early days, he actually, ironically or whatever, was involved in some correspondence in the early days that led to the establishment of Alcoholics Anonymous. I don't know what he would make of that as it currently manifests, but he's actually in the big book Correspondence with Carl Jung of all people. He had a term for addiction. He referred to it as a poor-form religious substitute. It just popped in my mind as I was listening to you, because if I'm addicted to heroin, that can be my big subversive activity, right? I had the echo of Jung in my mind. Jung might say, it's a poor form subversion substitute.
Absolutely.
Let's go for the real stuff. Let's really be subversive. Let's not opt out for something that's like an anemic version. Let's go for the jugulars. And that's what you're suggesting, is for people to live radically in their lives, live radically to values that are going to make a difference in their lives long term. That's the real stuff. That's not a facsimile of subversion. That is subversive.
Absolutely. I'm going to use what you just said, going against establishment rebellion. By the way, back in the day, when we look at the traditions in Western education, to be educated and to be in college or to be a college professor meant to be subversive to the establishment, because you're supposed to question the establishment. All of that is changing because we're training people to go work for, I won't use any names, but to basically plug and chug, whether you're at the terminal or whether you're making decisions. That being said, where was I going with this?
We could take that education thing. We don't need to do that right now, but just the idea that a university would be a place of free thought makes me think. And you probably have read this in times gone by, Thomas Kuhn's book, The Structure of Scientific Revolution.
I studied that for about a year and a half.
Yeah, you and me both. As he talks about normal science, and having spent 15 years of my life as a tenured faculty professor in a graduate school, and you have your own version of it, is that I really found the normalization of science going on. Is that there's only certain questions that are worth asking. And by the way, I don't know why we got kicked off of YouTube, but we may be talking into it right now, because you can sort of get kicked out of a faculty for questioning normal science.
Absolutely.
You know?
And it just brought me back to what I was going
Good,
at.
good,
So we are talking about this social angst. We're talking about this anxiety. We're talking about these kids. Actually, this is their escape. And I just thought of physicians. Nowadays, there's a lot of discussions about physician burnout. When you're on all the doctors' websites and all the education websites and all the physician burnout. And it's a really silly concept, and I'll tell you why it's a silly concept. The very people that are promoting physician health and saying, well, go do this, go do some yoga, go do some stuff, are the ones that have caused the physician burnout. And here's what I mean. As the profession became corporatized and we lost our professional status, a professional is someone who makes their own rules and makes their own decisions and has enough edification to be able to do that. Okay? Well, now we work for a corporation. Okay? And everyone has to be in line. What does that cause? Depression, anxiety, alcohol abuse, substance abuse. And then they talk about physician burnout. Well, residents nowadays train half the amount of time they used to train by law because we used to work them too long. Okay? All right. So they're working less, but there's higher burnout. It's really insane. And the burnout is when the corporations took over medicine and, the insurance. It's very interesting. And this is exactly the same thing as addiction.
Let's go with that for just a second. Let's imagine that I'm your patient and I'm coming in with an addiction to, let's say, to heroin. I come in and you're an extension of this corporatized way that medicine has evolved over time. I wouldn't disagree with you, and you're on the inside for sure. The same things happen in psychology. So no big surprise there. So I come to see you. Imagine if you have imagine if you're running as fast as you can, and you've adopted this kind of corporatization of medicine, hook, line, and sinker. Imagine I come in with an addiction, and imagine the probability of my having the conversation with you as my doctor that you and I are having right now in front of this camera. It wouldn't happen. There'd be no opportunity for us to look at anything other than let's get Bob through as quickly as we can, as efficiently as possible. Let's get him to comply. We can't have him be non-compliant. Can't have him question anything. Because if you're committed to that, wouldn't it follow that you'd want me to be committed to that in my own version too? Bob, I want you to be a good, loyal 7-Eleven employee and stop taking your heroin, But we wouldn't have any capacity to have the perspective that you do bring, which is that you're not part of the system. You're enough removed from it that you can at least challenge it.
Absolutely. And, at the same time, now that I recall, last time I was working for a big organization, the university, you're also worried about, is this guy going to go complain? Let me not. So, a doctor is no longer, is basically, they're consumers and I'm a product, right? So there's absolutely no place in medicine for that.
Yeah.
Certainly you should be rude and not be rude and have good bedside manners. But there's so much abuse from the consumer's part nowadays, and it's not wholly their fault, but the system's telling them it's your right. Right? This is, you go in and you have sniffles, and the doctor tells you, go home, you have sniffles. They will get upset and make a complaint. He didn't give me any antibiotics, he didn't give me any medications, and he just told me it's not a big deal, go home. Well, and these things have profound, deep consequences. Now we're talking about an example versus addiction. What are the consequences? I'm going to give you a medication that you don't need, and all medications have potential toxic side effects. I'm also changing your belief system from a reality, which is there's nothing wrong with you. For the last 100,000 years, people get colds. It's called a virus. To you need to come in, have something done, and what I did, even though you were going to get better anyway, caused you to get better. And so we're actually contributing to what Chris Hedges calls magical thinking of the current cultural system. I call it Disneyland thinking and so forth.
What would be an analogy of this that you're talking about with the sniffles or a cold to the work that you and I both do in addiction treatment? I know that you'll come up with something, but I'm just curious, in what ways do we contribute kind of unthinkingly to perpetuation of some of this magical thinking? Or would you call it Disneyland?
I call it Disneyland thinking. This guy Chris Hedges.
How might we unwittingly contribute to that if we don't have our eyes wide open in addiction treatment? Do you have any thought about that?
Extensive. Number one, the communication and the information that's passed on to both the addict and the families is oftentimes false, and it's kind of promoted by our cultural social values that are dictated by magical thinking. Okay, this is a moral failure. Okay, that's an insane thing to push on someone. Then from there it goes on extensively to everything from the terms we use: relapse, detox, do this sort of treatment and then you will get better. All of this is false. Right?
I found myself in recent months, over the time that I've known you and worked with you, Austin is producing us today. I found myself more and more, and I do it in the podcast that Austin and I do together. I'll catch myself just to make sure, and it's meant as a reminder, not only to myself but to the listeners, is that there is no magic bullet. I already used that term once here. I want to make sure that I don't contribute to this idea that a psychological perspective or a medical perspective or a spiritual perspective or a social culture, that is an incredibly complex phenomenon. So please stop supporting simplistic answers to a very complex problem. I just don't want to do that. And it happens all the time. Been really struck by that in addiction recovery as I've gotten introduced to the field by immersion over the years. How much stuff is stated that controverts scientific data is talked about all the time. I woke up this morning, I had this belief system about what cures addiction, and now that's the cure du jour. Drives me flipping crazy.
It's interesting you say that. The almost last conversation I have with every parent all the time is, they thank you, and from our first meeting, and I reiterate this over and over. Please remember, I'm not a magician. I'm not a snake oil salesman. I make no guarantees, and I say this not because of any legal action you might take against me, but it's to reinforce on you the complexity of this disease, and we can have positive outcomes, but curb your expectations. I don't know how much time we got, Austin. Because I'm having a great time.
As much as you want. We're at 30.
Let me respond to something else. Let me respond to something. So give me just a second. I want to get back to it. Let's see. And we'll splice this in or whatever like that. I've wondered about this as a psychologist over the years. I was required every 2 years to do 16 hours of training in ethics, professional ethics. So that means for decades I took ethics courses and I taught ethics courses and so on. But one of the thoughts I had sitting in one after the other ethics seminars is there oftentimes be a citation of the Hippocratic Oath, do no harm. And I would sit there and find myself questioning, as soon as I'd write down the things that we do, that we're trained to do in psychology, to do no harm. Does anybody question the ethics of the ethics? It's like, so for example, I'm going to pick the example you just gave. So you sit with the family and you temper their expectations. And let's say that they actually get a little bit anxious, or a little bit, I'm not going to say depressed, they feel some grief over the fact that this may not go away, or this may be a long road, or this may be more complicated. Have you done harm? Now, I would argue that you haven't done harm. In fact, I would argue that you do greater harm by the Disneyland thinking. But you can imagine how paranoid you can get in this field. My field, your field, like that. Pretty soon you're making sure that whatever you do, you don't make anybody the least bit unhappy. Don't send them home with sniffles, Dr. B. You know, that could be a problem. Don't tell somebody the truth about addiction being a multifarious issue. And it gets really crazy to me. And I got really sick of this as a professor of psychology as well as a practicing clinical psychologist. You got to where it was CYA. You just got to where you're covering your posterior more and more often, to where at that point I feel like that everything you're doing is doing harm because you're not showing up professionally.
Right. So I do have a kind of a multi-pronged answer to that. Number one, we have to separate real harm, what we used to call harm, versus the magical thinking and pat on the back into society. We discussed earlier how certain movements in Christianity in this country right now really validate your delusional cognitive dissonance of reality. Okay, I'm not going to tell you the truth. I'm going to tell you everything's okay. And in that case, I would argue that this is a case where, well, you can't tell a cancer patient you're not dying, so go ahead and take that trip to the Alps and go skiing instead of taking care of your affairs. You have to address these issues. So am I doing harm? In general, I will say this, and I tell other patients this, and this is one of the reasons I left emergency medicine. I tell patients, the minute you walk in through the door of a medical facility, and I used to teach residents this, the minute they walk into the doors of the ER, we're doing harm. Okay? And I even tell my own patients now, and I used to tell them in the ER, I used to say, look, let me give you some advice, and take this in the right way. Talking to me is doing you harm. Okay? When you come in here and expose yourself to me, there's a potential for harm.
I'm right with you. Right.
Because what I'm doing, depending on what I say and the tests I get and the false positives that we come up with, I'm going to cause at the very least anxiety in you. And so you are right in a sense, right? Anything we do to them is harm. And that's why I would tell residents, please understand, get people to minimize your contact with you, especially as we've turned into a consumption society, including medical care. On the other hand, another way to answer it is unfortunately, we've gone way too far in society and our culture where there's a complete disconnection from reality. And so now I would say the harm is telling the people to lie. Does that make sense?
It makes complete sense to me. It makes me think that at one level I can be doing good. I can be it's like a benign tumor or something. I can be doing good. But at a deeper level, the level that we're looking at from a social critical perspective, at a deeper level, I can be doing a harm that actually is far greater than any supposed cure at this level. And so it's almost like you need to think of different levels, like like a meta level or something like this. And I think that conversation doesn't happen often enough in psychology. I don't presume it happens often enough in addiction recovery. I get all kinds of mailings every day, and I'm sure that you do as well. And most of them are kind of uncritically passed out there and assimilated by people, but there isn't this level of critique going on that we've talked about today, looking at addiction from something other than a very kind of narrow tunnel vision kind of perspective. Really appreciate the fact that we've opened up the aperture. I'm looking forward to more conversations with you, Dr. B. This is enlivening to me.
Yeah, this should be exciting. We should get better. We were hoping to do a live stream today. This is our first one. I'm sure we're even going to get better at it, have other guests come and join us. And we're hoping this develops on its own. Those of you that do get to watch this, please let us know where you want us to go with this. And I think we can wrap today up, huh, guys?
It's great. That's great. Awesome.
All right. Thank you very much, Dr.
I'm happy to be here.
And thank you, everyone, for watching.
Thank you, Austin.